Sam, the day-to-day activities of work, life, and home can sometimes sneak up on us, causing a sense of physical and emotional exhaustion. Here today to talk about identifying and coping with workplace burnout is Dr. Sharon Kiely, Chief Wellness Officer and Associate Chief Medical Officer at Hartford HealthCare. Good afternoon. Thanks for being with us, Dr. Kiely.
It's my pleasure. Thank you.
So how does workplace burnout affect people, especially your frontline workers?
Workplace burnout can be experienced by people in many ways, but most importantly, they feel an extreme sense of fatigue and a separation from what's happening in front of them. So that could be their family, that could be their work, that could just be themselves, and they feel as though they're just going through the motions.
All right, talk about what are the triggers for workplace burnout, and are there ways to possibly prevent it?
Well, the main trigger for burnout in the workplace is stress that is unrelieved over a long period of time. And so as we think about the COVID pandemic, it has been the perfect storm for exacerbating burnout in the workplace. And so the things that we've been doing to try to disrupt that cycle, and in order to get people to really focus on themselves a little bit more, which doesn't come easy really to healthcare workers. They're very selfless people. We have been trying to embed things in the workplace to disrupt that and bring people back to some mindfulness, some rest. We've encouraged people to take their time off and really take their time off and not just be home but checking their email. And so we've worked largely with our leaders of people at Hartford HealthCare, giving them the skills to manage their teams and monitor their teams to make sure that they're doing okay.
All right, what are some ways to make people feel better about their work?
I think in healthcare, people feel wonderful about their work. They've been committed to this pretty much since the point at which they decided to either go into physical therapy or respiratory therapy or medicine or nursing. I think recognizing healthcare workers for their personal sacrifices during this period of time, I think is the most meaningful thing. A handwritten note from a patient, the recognition of a supervisor or a colleague. We at Hartford HealthCare do something that's very meaningful at the beginning of our meetings. And we recognize people for their contributions, we celebrate successes, and we share patient stories, which brings us back to where we are in terms of why we came into healthcare. And so those gentle reminders help as well, but really recognizing the good work that people are doing every day.
I have a family friend who was very sick and alone with COVID in the hospital, and the nurse was like his family. She got him through and gave him hope, and they're good friends still. All right, what are some resources, Dr. Kiely, to those struggling with burnout and fatigue?
Sure. One of the things we do know that people are unaware of how burned out they are. Hartford HealthCare just launched something called the Wellbeing Index for all workers, all 33,000 across our system. The Wellbeing Index allows you to check in on your well-being, much like knowing your own blood pressure. We don't know our blood pressure unless we check it. In addition to that, we have resources that are available 24/7 through our colleagues' support line and other avenues, and those are available at every single nursing unit, every single huddle board for our staff.
Dr. Sharon Kiely, thank you so much. Great information.
Thank you.